The cloud. Okay, we're recording.
All right. So good afternoon, everyone. As I said, I'm Stephanie Small. I'm the Clinical Director at Jewish Family and Community Services, and I'm here joined by our staff from UpStreet, our teen mental health program. Unfortunately, we're here today to talk about death by suicide in teens and young adults. Death by suicide is the second leading cause of death among young people between the ages of 10 and 34 after accidental deaths. And suicide is preventable. And we need to educate ourselves on how to be aware of what we're looking for, but what suicide means, what suicidality means, and what we can do about it. So I'd like to introduce our panelists. Today we have Erin Barr, who's our clinical coordinator of UpStreet, who's going to give some information about suicide. We have Aaliyah Kimbrough, our adolescent therapist, who will be talking about myths around suicide. We have Stephanie Rodriguez, our other adolescent therapist, who will be talking about what to look for. And we'll all then discuss what to do with this information, tips and trades and tricks of what to do. Again, please put your questions at any point in the Q&A box and we will address them in the end. We are recording this for future reference and for future use. And now I will turn it over to Erin. Thank you.
Thanks, Steph. So again, my name is Erin Barr. I'm the clinical coordinator for UpStreet. Some of you may know what UpStreet is and some of you may not. So just to give you a brief summary, we are the teen and young adult mental health service of Jewish Family and Community Services. So we see people between the ages of 12 and 22. We provide therapy. We have Aaliyah and Stephanie as our therapists. And because of the generous grants that we have been given from funders in the community, we are able to provide therapy at no cost to our clients. We do not need to bill insurance, which makes our services really accessible to anyone, again, between the ages of 12 and 22. We also offer live chat to help with like brief support or sort of immediate support for young people. So anyone can come to our website, which is upstreetpgh.org. A little chat box pops up in the corner. You just start typing into it and somebody is available to talk to you, or to talk to the young person that's on the site. And someone's available Monday through Friday from 10 a.m. to 8 p.m. And then Saturdays and Sundays from 2 p.m. to 10 p.m. So we're pretty available. Our response time is pretty good. You can send young people onto our website to talk, and you as adults, youth providers, parents, whoever you may be, you can also use the chat for questions you may have about young people in your life. Okay, so moving right along. We don't have a PowerPoint or any type of presentation prepared for today because we wanted it to feel a little bit less formal and more personal, although we can't see any of you and you can't see each other. So in hindsight, I don't know, we could have done something different with that, but here we are. So like Steph said, we will take questions, put stuff into the Q&A. We'll get to it at the end. We do intend for this to be the first of more webinars on this topic. So if there's something that comes up, a concern that you have, or a particular question that for whatever reason is not addressed today, stay tuned. It will likely come in a later webinar. So let's see. Also, I think it's important for us to acknowledge that we know how heavy a topic this is to be talking about. And so if at any point it's too much, it becomes too much for you, you're feeling yourself getting sort of escalated, please leave. Please take a minute to do whatever you need to do. Take care of yourself. That's an important part of talking about suicide, I think. Also know that we'll be available for a few minutes beyond 1 o'clock if anyone needs to talk anything through or want some additional support. All right, so we're going to try this. This is so difficult for me because I can't see anybody, but I am curious to know who is here. So I guess by way of the chat, like, you know, I'll throw out some categories, and if that category applies to you, just say like me, or if you can raise a hand or somehow indicate. I'm curious to know how many people are youth professionals. So like you work with youth in an after-school program, through some religious institution, a club, some organization that just works with youth. I would be curious to know how many of you, oh, hands are raising. Look at that. Okay, great. Okay, a number of you. What about teachers, educators, school staff, school counselors, school social workers? Good. Mental health professionals. I know we have some of our coworkers that are here. Therapists, caseworkers working in juvenile probation. Good. Welcome. Oh, quite a bit. Okay. Now this one may apply. You may have already raised your hand, but please again, parents. How many parents or people that are here that have a young person, teenager in their personal life? I know there's a lot of crossover there, obviously. Okay, that's great. Thank you. Thank you for sharing. It makes me feel better. I feel more connected to my audience now, so that's helpful. Okay, so just to sort of start out, why is this happening right now? Why are we in a place that we need to be having webinars and talking about youth suicide? I wish I had an answer for you. There doesn't seem to be a consensus as to why we're seeing this increase in suicide. There are a lot of ideas, theories that are floating around, including things like increased exposure to traumatic events. I've heard people talk about this generation, like this high school age generation, as like they're the school shooting generation, they're the mass shooting generation, because this is something that they have experienced throughout their time in school and throughout their young lives. Which is markedly different, I think, than for a lot of us. I will date myself. I was a senior in high school when Columbine happened. And that was like, if you remember that was a huge deal. That was really the first time that there was such a public event like that, something like that happening. And it sent this shockwave through the country, right? And now we're at a place, how many years later, where it's sort of like, when's the next one going to happen, right? So that might be part of what's contributing to rises in suicide. Other things like bullying that's happening, increased stress, especially now when we're talking about the isolation and the pandemic and people just sort of being cut off from their existing support systems. There's always higher social media use and how that affects teens and their mental health. And also, easier access to means. It's surprisingly and shockingly easy to buy firearms and guns and weapons. The opioid epidemic might be something like people have drugs in their home that they didn't used to have, although we do know that death by overdosing is not all that common actually when you look at rates, but it is still a potential factor. And again, Stephanie said, we know that there are more suicides happening. The second leading cause of death between 10 and 34-year-olds, second only to accidental injuries, so things like car accidents. So that's a concerning number, to say the least. And over the last 20 years, there has been an increase in suicide rates among all people. So it's something that's been occurring and something that we will continue to have conversations about. So that's sort of our intro. I'm going to turn it over now to Aaliyah, who's going to talk about some misconceptions.
Hi, everyone. I'm Aaliyah. I'm the new adolescent therapist for UpStreet. And some of the myths that we thought it was really important to debunk and talk about was that teens who threaten suicide are just looking for attention. Whether they made the attempt or not, it was not them seeking attention. Oftentimes, teens are very good at hiding things. If they're bringing up the topic or talking about it, they may be asking for help, and they need to be taken serious and listened to. They're not asking for attention, they're seeking help in those moments when bringing it up and wanting to talk about it. Another common myth is asking teens if they are thinking about suicide may increase their risk. That is not the case. Being direct and honest is often best, and it may allow for them to actually be able to feel comfortable and vulnerable to talk about that situation after being asked, and having someone that they care about asking them directly about that. It could be a sign of support and help for them as well. Another myth is that it is rare for teens to commit suicide or attempt to commit suicide. As Stephanie said, it is now the second leading to accidents. So it's not rare, and it's happening, and it's increasing. Another myth is that those teens who commit suicide take a lot of time in planning it. That may be the case for some, but that's not always the case. Oftentimes, it's a very impulsive decision, and at that moment, it feels like they have no other choices, and that's the only way that they will help release or get rid of that pain. And lastly, if a teen attempts suicide and survives, that they will not make another attempt. Unfortunately, that decision was made because they thought they had no other choice and that they felt they were in an increasing amount of pain. It may not be the case that they won't try that again. They very well may need some additional support and help after to not feel in that place again. Having the correct supports and help afterwards in those situations can help teens feel that they are not alone in those situations and that they have more options to make outside of just trying to end the pain in those ways.
I'll actually just jump in there too, and because in fact, previous suicide attempts is a risk factor, right? That's something to be very aware of. It doesn't mean there's no concept of like, oh, they tried it once and it didn't work, so they've gotten that out of their system. It is in fact a risk factor. So knowing that someone has attempted a suicide before is something to be aware of and legitimately be concerned about.
As well as if they have tried once, they may try again in a different way that could be more successful, unfortunately. I will turn it over to Stephanie to let you know of what type of things we should start to look out for, or what types of things to listen for.
Thanks. So yeah, I just wanted to start by, I'm going to go into a little bit more of a positive direction to start, and then I'll go into more things about what to look out for. But I wanted to just touch a little bit on the protective factors to keep an eye out for, to know about the teens in your life. Those things could be important friends and family in their life. It could be a pet. It could be your faith. There's a lot of different things to keep an eye out for, so that, you know, there's something holding them and wanting them to stay and be in or to continue their life. I just wanted to give a little example too. I had a client that once had thoughts about attempting suicide, and thank you. Sorry, yeah. So I forget what I was saying. Oh, my client, sorry. My client had ideas and a plan, and ran into their father in the midst of having these thoughts, and it kind of snapped them back into a reality, because a lot of times suicide is very impulsive. So something to just keep an eye out for, making sure that, you know, the teens in your life have some of these protective factors for them. Some different things to look out for and to be aware of in your teens' lives is what's been going on. So have they had a major stressful event? Has there been any traumas? Bullying is a big thing too right now, especially for teens. There's no escaping from bullying. Social media and, you know, the ability for them to be connected at all times because of their cell phones creates almost like an atmosphere of not being able to escape from bullying, which, you know, as we grew up, we were able to escape. We didn't have the social media that they do now. We were able to go home and get away from that. But nowadays, you know, they're not able to escape the way that we were able to. So being at home doesn't mean that they're getting away from bullying all the time either. A big thing is changes in behavior also. So if you're noticing that their eating habits are changing, sleeping habits, maybe their appearance is changing, they're isolating, staying in their room more often, academics like grades and stuff are changing. If they're showing a lack of interest in their future, so maybe, you know, those older teens that are kind of looking forward to their next step after high school, if they don't have any want or need or plan for the future, that's another thing to kind of keep an eye out for. A lot of times too, they're sharing their feelings of unworthiness and rejection, having a lot of negative self-talk. Those are some big signs too. And then leading into that too is physical symptoms. A lot of the times the stress that teens are dealing with can lead to these physical symptoms. So if you notice a teen is not being able to go to school because they have a stomach ache or a headache, or they're, you know, making different comments to you about their physical symptoms, that's another thing to make sure that you're keeping an eye out for. And then also substance abuse can fall under this, also something to just look out for and know and be aware of if there's means of substance in the house too, like if there's easy access to alcohol or drugs or things like that. And then one step further in that, for the means in the home is their weapons in an easy access area? Is their medication in an easy area that they can get their hands on? But yeah, that was the parts for the means of what to look out for in your homes.
Okay. I think the next thing we wanted to talk about, and is probably the harder thing to talk about, but the thing that people wonder about the most, is sort of like what to do if somebody comes to you, if a young person that you're working with, or I mean, anyone really in your life comes to you and talks about suicide. So I think maybe it's helpful first to distinguish like some terms here and what the difference is between something like a passive death wish, which quite honestly is something that I think a lot of people have, right? Like we have these moments where it's like, oh, it would just be easier if I weren't here, or if this could just all be over right now, my life would be a little bit better. Or like, I wonder what would happen if I just walked out in front of a bus, right? That's a passive death wish. I've been in trainings with that are run by therapists that admit to having thoughts like this. Like they're not uncommon. And that's not necessarily the same thing as a suicidal ideation. Suicidal ideation is sort of thinking, planning, considering dying by suicide, doing something, making a move, behaving in a particular way with the intent of dying. So that's when you're thinking about like level of alarm that you should have. Like the ideation is a raised alertness for sure. We'll talk about a little bit more. It's not something you necessarily need to pry into or ask more questions about if it's something you're not comfortable doing. Certainly therapists, mental health professionals, that's when we jump in, right? Like that's definitely, if somebody brings up something like that, we don't ignore it, we don't walk away from it, we explore it with them. As I think Aaliyah mentioned, talking about suicide or asking about suicide doesn't make somebody more likely to do it. I think there's a concern, well, if I mention it, I'll put that idea into their head. And it's just not true. Nothing supports that. It's the opposite. Asking, giving them a space to talk about it can actually help de-escalate the situation. And then a suicide attempt is something, an act, that's potentially dangerous or harmful with the intent of dying. Like, so I did this to myself because I wanted to die. It's not the same as self-harm or self-injurious behaviors, right? People will scratch themselves or cut themselves or burn themselves. And it's not necessarily because they want to die. That's something else completely. Although self-harm and self-injurious behaviors can be risk factors for suicide, right? Because it could get to the point where like, that's not enough anymore. And so taking it to the next level. It also can create an environment or a situation where it's accidental, right? Self-injurious behavior is not something to take lightly either, but it's not necessarily the same driving motivation as a suicide attempt. So hopefully that's clear. I don't know. I mean, suicidal ideation is something that comes up a lot when you're in therapy, you're talking in the mental health world. I don't know how common it is in the language of youth professionals or parents that just have teens. So I wanted to make sure that we pointed that out. Okay, so what to do? There's a lot of things to do. There's a lot of things to keep in mind. I think it's important to know, and I might repeat this again, you are not the ultimate decision maker in someone coming to you with suicide. There are professionals, there are crisis text lines, there are suicide hotlines, there are people there whose sole job it is to intervene in situations like this. So I can't encourage you enough to take advantage of those resources. They are listed everywhere. They are on our website. You can Google them. There are multiple options for you. And truth be told, mental health professionals, therapists use these resources too, right? Therapists call resolve quite a bit, actually, when it gets to the point where there's only so much we can do to intervene as therapists, as mental health professionals. Sometimes we need to call in backup too. So there's no shame in calling somebody else. You're not expected to deal with all of this on your own. One thing to keep in mind, and this is sort of a precursor to everything and maybe a conversation we need to be having more often in the youth professionals outside of the mental health world, is doing what you're doing today, staying educated, learning more about it, becoming comfortable with the uncomfortableness of suicide. It's a sad thing to admit, but I will be honest, I'm not sugarcoating anything. I think mental health professionals and therapists, we have a certain level of comfort with the idea of suicide because it is something that we are taught from the minute we enter graduate school. It is something we expect to encounter in our profession. It's just part of our industry, sadly. So that's not to say that we enjoy it or that we're like, oh yeah, I can't wait to deal with that, because it's not true. We get emotional about it. We get worried about it, but it's just something that is, more commonly talked about, I think, in our field. And so maybe we need to start exploring how youth professionals also can stay educated and also develop self-care. Because one of the things I'm about to suggest to you is that when somebody comes to you and talks about suicide or has ideations, is the importance of you staying calm yourself and being present with them in that moment. And I realize how difficult a task that can actually be, especially if you haven't practiced these skills before. So having your own self-care routine, practicing whatever it is, breathing exercises, mindfulness, so that you've calmed yourself down, or you have practiced doing some of these things in situations where you don't need it. Right? Does that make, like, the best time to practice a breathing exercise is not in the middle of a panic attack, because you're already heightened, your brain is not functioning in its normal way. And so having practiced those things before you need those skills is a really helpful thing. And so self-care, implementing routines for yourself, practicing calming exercises, giving yourself experience, relaxing your own nervous system, your own emotions, so that when or if somebody comes to you and talks about suicide, you have those skills to rely on. You've used them before. So I think the fact, again, staying present and listening and appreciating the fact that that person is coming to you to share those feelings really speaks to the strength of your relationship with them. If they did not trust you, if they did not feel safe with you, they likely wouldn't tell you these things. So there's something to that. And it might be that kind of situation where, it's not the conversation you want to have with somebody, but recognizing and giving yourself credit for your ability to build such a safe and trusting relationship with a young person. And then also being able to sort of like sit there with them in that moment. So I think it's okay to say to them, I appreciate you sharing that information with me, or I'm glad you told me. I'm glad you came to me. It's also okay, I think, to say, I'm glad you came to me. This is not my area of expertise. I'm worried about your safety. Let's talk to somebody who knows what to do, or let's bring somebody else into this conversation to help us through this so that we can make sure that you are safe. I think that's important. Again, you're not the ultimate decider in what to do. You don't have to make a safety plan. You don't have to make the decision of whether they need to go to the hospital. Resolve, crisis lines, the suicide hotline, they can all make those decisions, and they can help you ask the right questions. Because even as trained as we might be in that moment, I think we always have like, did I ask the right question? Did I miss anything? What am I forgetting? Like, these thoughts run through our heads too. And so that's why we call Resolve also, because they're there to support us. Let me see what else. Right. So recognizing how scary it must be for that person to be having those thoughts, number one, and even scarier to say them out loud, right? Like, we all have thoughts in our head and we think about things all of the time. And then the idea of like telling somebody about them or speaking the words out loud is even scarier. So them coming to you is something to acknowledge and validate. Stephanie mentioned this before, we've talked about it. If it is a young person in your house and you are concerned about them, or they're talking about suicide, remove means. If you have weapons in the house, lock them up. If you have medications, take them away. Even, people go so far as to like take knives out of the kitchen. Anything that could potentially be a means to suicide, as much as possible, remove access. even the slightest bit of frustration or the slightest bit of interruption in that plan can be enough to stop them in the moment. Like Stephanie said, the client that was in the process of going to, had a solid plan for it, and then saw her dad, and that was enough to interrupt it. So having to unlock a safe or look for the key or try to find out where this is, that can be enough to like remove the impulsivity or like sort of interrupt that impulsivity in the moment and stop something from happening. I also think it's important to pay attention, again, like Stephanie said, to the protective factors. What are some things that you know about this person that you can start bringing up now? Like, what about, what about that commitment you made, or what about your friends, or what about your dog? What about these things? Let's, bringing them up in the moment, getting their brain to sort of like redirect itself and think about something else can be enough. If you know that they have a good routine of self-care or other coping skills they've talked about, and it feels right, bringing those up. Maybe it would help if you practiced that mindfulness activity you've been doing, or going through that meditation practice that you've been working on, helping them through it, or mentioning those things, pulling up YouTube videos, like whatever it takes to sort of help them calm their system down. Again, I'm giving you all of these suggestions and things you have to do, but I also recognize that you might not be able to do it, right? Some of us are just not good in a crisis. Some of us are too concerned or too emotionally invested to handle these situations. So call resolve. Do the crisis text line. You can sit there with them and do that together. It's not like you have to just sort of like give them a phone number and be like, good luck. I hope that's helpful. Stay with them. I will say this is probably the moment where you need to clear your schedule. Cancel your plans. Like, you need to stay with that person. Call somebody else pick up the kids. Somebody else can take care of dinner. As much as possible, being present and able to stay with the person. We say, staying on the phone with them, keeping them in your office, keeping them in your building. Once we're in person again, just staying with them so that they're still feeling connected to somebody. I'll just mention some other resources that exist. I've mentioned Resolve, which is for Allegheny County. So I don't know if there are people from outside of Allegheny County here, but you could call Resolve. They would redirect you to your local crisis center. There's also the National Suicide Prevention Lifeline, although I've learned that if you call their phone number, they just connect you to your local crisis center. I called the National Suicide Hotline for somebody that was in Ohio, and I just got Resolve on the phone. But again, then Resolve, I said I need somebody in Youngstown, and they connected me to that agency. The one thing about the crisis center people, though, I will say, is they are incredibly calm, like almost annoyingly so, because I'm like, this is an urgent situation. And she's like, yes. How long ago were you speaking to the person? Right? They're very calm. They're very factual. They are emotionally removed from the situation. So they will make sure they get all the information they need. They're not going to miss anything. So rely on them. They're very good at what they do, for sure. There is the crisis text line, which is a text line. So I think you text home to 741-741. That's an option. And then it's a text thing. So you can sit there with that person on your phone. You can sit with them on their cell phone. And while they're texting with a crisis professional, you can be sitting with them. You can call Resolve. You can call for them, right? You don't have to give them the phone and have them dial. You can call and say, I'm sitting here with somebody. They've talked about suicide. We're reaching out for help, right? And the situation can escalate. Eventually you can give them the phone, but it's not something you need to make them do. They get, even I think on the Suicide Prevention Lifeline, they have a text or a chat also, and it says, are you calling for yourself or are you reaching out for somebody else? So that's definitely something you can do. And they might make you feel better too. Like, they're there to help you stay calm. If you've ever called 911 for anything, right? Like, they're calm. They walk you through it. They sort of recenter you and bring your brain back online so that you can make decisions and you're thinking about all of the right things. If necessary, getting medical help. So like if something has happened or there's a medical concern, obviously you want to call 911 in that case. I don't tend to recommend calling 911 as your first resource for a suicide, because 911 is going to send the police. And the police aren't always the best people to respond to mental health crises. So Resolve is a good first bet because they have a team of crisis specialists that they can send out. So you're getting like a social worker, caseworkers, people that are trained in this and that aren't necessarily going to show up in full uniform with police cars, which can escalate a situation sometimes. Okay. What are we missing? I feel like that's what we have prepared in terms of what we wanted to talk about. I'm not seeing no questions in the Q&A. So what else are people wondering about? What didn't we talk about that you were hoping we would address today?
So please put stuff in the chat, everything else. I'm going to let Erin take that question. I just want to, again, emphasize some of the things that they've said about looking for changes in behavior, about interrupting behavior, again, locking things away, not being afraid to be with the person and just being there with them, reaching out to the experts while you are there with them. And that talking about suicide does not suddenly make teens and young adults go, oh, that's an option. If you're talking about it, there's a good chance they've already thought about it. You've just made yourself available to be a person they can talk to about it.
Yeah, Steph, and I think that goes to the question. This is from Staunton Farms, although I'm assuming it's probably you, Joni. But so, because we don't talk about it, right? We as a country, as an adult population, are afraid of it ourselves, I think, or it's something that's uncomfortable for us. So it's not something that's talked about. I think you're right, because it's a difficult thing to think about. We don't want to think about it. It hurts and it's scary and it's sad. And so it's something that we avoid, I think, which I think also then sends the message that it is taboo. And the less we talk about it, the less likely young people are going to be inclined to bring it to us, I think. I'd be curious to hear other opinions. Oh, Bethany. Sorry, Bethany, it just says Staunton Farms, but I'm glad you're asking because it is a good question. You're right. We're very concerned about youth weight gain and all of these other things that youth are experiencing, but what about suicide, especially with the rates as high as they are? And it's something I was doing research, and suicide rates amongst everybody are young people are twice as high as homicide rates, right? So this is a real thing that's happening. I was in a meeting yesterday, and I keep using this metaphor because I think it was a good one. She was referencing an article, but it talked about the mental health crisis as like a Category 5 hurricane. And a Category 5 hurricane's coming up the coast and nobody's ignoring it. Everybody's talking about it. People in Oklahoma who are landlocked and have no water. Is Oklahoma landlocked? I should have checked. I think it is. Thank you. Right, they're talking about it, and it has nothing to do with them because it's a major event. And I feel like that's where we are now here. I don't say that to alarm anyone, but it's the reality. And maybe we're feeling it because we're mental health professionals and because we work, and you're feeling it because you work with young people. So yeah, the more we talk about it, the more we make it part of our language, I think it just normalizes it, right? It reduces the stigma. Hopefully it encourages people to reach out and talk about it for themselves when they need to. Okay, so there are some questions, although I'm seeing stuff. I saw one thing in the chat, mental health first aid. Yeah. Parents should take it. We are planning to do a youth mental health first aid, to schedule one for the community, for the Pittsburgh area. The idea of mental health first aid in general is very similar to, CPR first aid that a lot of us have to take for our jobs, that maybe we all took when we started to have kids. We are not the EMS professionals. We are not doctors. But when somebody is bleeding, when somebody's hurt their leg, having the first aid training makes you more confident and gives you some skills and sort of the immediate what to do right now until we can get the professionals here. So mental health first aid is the same idea. It's giving you things to look out for. It's giving you the questions to ask. It's giving you some of the language to use when you're worried about a young person that might be suffering or experiencing some type of mental health concern. It doesn't expect you to be the one to diagnose. You're not supposed to treat them. It's just giving you an overview and sort of some skills and confidence to talk about things like that with young people, and then what to do when you are concerned. So yes, we do suggest that people get trained in it, parents, youth workers, anybody that's involved with young people. There's an adult version of it as well, and then there's the youth version. So we are in the process of planning some of that. I know I was talking to people from Staunton Farms and from the 1027 Healing Partnership, and people from the county, Allegheny County as well, about getting a training out there for parents, youth workers, anyone that has a young person in their life. Let's see. Suicide prevention programs that you recommend for middle and high school age students. So that's a good question. Right now, I'm not aware of any. I was going to say, I'm sure they exist, but then maybe to Staunton Farms, to Bethany's earlier question, maybe they don't, because we're not talking about suicide and we're afraid. Oh, Stand Together does do reducing the stigma around mental health, which can be a protective factor, right? So bringing the conversation of mental health to the schools. So it's not, Stand Together is not a program that you bring in for like an assembly or like a one-off thing. They come in, it's like a school club or an activity. Students get involved and they put on programs, or they come up with some kind of project around mental health. Things like, I know of schools that have done, bake sales to raise money, or the soccer team wears a certain color during Mental Health Awareness Month, just to bring awareness to it and start the conversation. And I imagine that it's hard to have a conversation about teen mental health and not talk about suicide. As a parent, okay, so I don't know if you all can see the question, so I apologize if I'm reading things that you already know, but someone asked, as a parent, how do I carefully try to parent without sending my son into a rage and depression? Yeah, that's such a tricky one, because especially when it's your own kid, your own child, I don't know that there is a relationship you can be more emotionally invested in, right? It's one thing that therapists and mental health professionals we talk about all the time, or we're trained to do, is like, you have to have some boundaries there. Like you don't want to remain cold and uncaring, but like you have to keep your emotions in check throughout the relationship. And that's very, very difficult to do when it is your kid, especially when you're worried about them. So I think some things and other people can jump in, by the way. I will talk forever. So wave, I can see the four of you. So wave at me if you're like, I have an idea. I think one thing to do is, again, make it part of the conversation. Talk about mental health in your house. Talk about your own feelings. Model for your kids at any age how you are feeling. I'm feeling really upset today. This happened at work and I'm really stressed out about it. So what I'm going to do is practice this thing, whatever it is that helps you calm down. And then you can refer them out. Again, as youth professionals, you don't have to be responsible for the mental health of the kids that to some degree you want to be responsible, but it's not ultimately, you're not the be all end all of their treatment or their help. You're like the first step. You're like the triage sometimes, right? So as a parent, as much as possible, keeping your emotions out of it, offering suggestions. I think especially with teenagers, I had a professor in graduate school that say, like, we're seed planters. You drop things, you put these little seeds in the soil throughout their life, and you hope they grow into a flower. There's things you can do to encourage it and nurture that environment, but it's ultimately up to them. You just hope that what you're talking about are things that they're going to remember or hold on to. I mean, even leaving, like, if you're really concerned, you could just leave the number or the crisis text lines, how to text them, put that in the room somewhere, put it on the bathroom mirror, somewhere where they're going to see it. So you're like telling them without being in their face about it. And maybe they will get upset and roll their eyes or be annoyed at you, but maybe that's a risk that's worth taking.
I want to jump on that because what Erin just said is important. They're going to get mad at you. They're teenagers. That's how they're programmed to handle stress, is to lash out at the people they love. But by putting the number there, by reminding them periodically, often, however you want, that you're there, you are actually acting as a protective factor. They know someone actually cares about them. They often feel, kids with suicidal ideation have this feeling that no one cares, or if they're gone, that it wouldn't matter. And by showing them, by leaving the notes, by telling them, I love you, by leaving notes in their lunch boxes, if they still have lunch boxes, in their wallets, by doing things like that, you are showing your support of this child. I love you unconditionally. They hear it in part of their brain, and that's a protective factor. So even if they yell at you, that's actually okay. It hurts for us. I mean, it stinks for us as a parent to get yelled at. But by yelling at you, they're actually engaging, and they're actually showing in their own weird teenage way that that's how they're okay with it. If they actually ignore you, that's more of a danger zone. So Stephanie or Aaliyah, I would love if you would jump in as well. Any ideas for parents specifically would be very welcome.
I was going to say a really good kind of thing that I've heard that's been helpful for some clients that I've worked with is the notebook idea. You're sharing a notebook with your child and allowing them to write down whatever it is that they would like to talk to you about, and have a conversation with them about what you would like this to look like. You can either write back to them via notebook, you can schedule the time to talk about whatever it was that they wrote about, or maybe it's things that they just want to write to you that you don't talk about right now. Obviously, if it's concerning things, you'll bring it up, but in ways of building that relationship, building that trust, building them to be vulnerable with you and to be able to open up about some things that may be scary to talk about with you.
Yeah, that's a great idea. Another thing too, Erin touched on it a little bit, was the self-care piece about yourself and, making sure that you have the coping skills that you need and then using them as an example, because that's the way kids learn, right? Like they learn from what their parents do. They learn from what they see, they copy, so that's a huge one. Like if you are having a hard day, expressing that and sharing, like, I'm going to go take a nice hot bath because I've just had a really stressful day. I'm having a hard time. Being open and honest about it is the best way of communication with kids. And it just allows it to flow better too in the house. Me sharing my experience helps the kid in the home also. And then also, like with your coping skills, we refer to it a lot of the times as a toolbox, and building that toolbox so that whenever the time comes and they are having that hard time, they have options. They know their options. And just building on that as things go too, because what helps one day might not help the next time. And as we grow too, like our coping skills always are changing. So the more you build that toolbox and the more you have in that toolbox for yourself and for the child in your life, the farther along it goes too.
Yeah, I also want to point out, I don't know who, JFCS webinars, so it must be one of our coworkers, brought up a really good point too, that one of the ways to have a conversation, like now is a good time because there were just 2 suicides. 2 people did just die by suicide. And even if you're outside of the Jewish community or you don't live in Squirrel Hill or they weren't people that you knew, they are still 2 young people in Pittsburgh. They could have been in any of your programs. They could have been one of your kids, right? So even going home today, or when you see your kids today saying, like I went to this webinar, I attended this meeting today, and we learned about this. Like they said, there were 2 young people in their early 20s that just died by suicide. Like really brought up a lot of stuff. Do you guys talk about that at school? Is that something that comes up? Like, are your friends talking about that, right? Like the idea of the notebook, I think, is like it takes the personalization out of it. It's not like a face-to-face. I don't have to look you in the eye and have that conversation. So anytime you can, I'm asking for a friend, that applies here too. So making it about somebody else, but sort of like, again, planting that seed, dropping that little piece to see if there's any reaction to it. Do they pick up on it? Is it something that they want to talk about? And even if it's not something they talk about today, the fact that you said those words today, that you started that conversation, or you at least opened the door to that conversation, they, teens, who knows what they're actually hearing and paying attention to. And then they come back and they're like, hey, you talked about that. I remember you said that, like you talked about that the other day, like it did come up in school today, or one of my friends did just, or I saw this on social media. It sort of opens the door. It sends the message that this is something that we talk about in this house. This is something that it's okay. This is a word that's okay to use and a concern that's all right to bring up.
Sometimes you can ask questions of how your day was, and they very well may not answer you. I do that for a week. That last day, they might have had something that happened and they may talk to you about it. So I know that oftentimes teens can ignore the questions of you trying to be concerned and things like that. Again, like Steph said, that's kind of their way to be anonymous and keep to their own privacy, but continue to ask for it. They'll know that at least that when something does come up, well, mom's asked me every day this week how I've been doing. Maybe she really does want to know or does care. So it may seem as if they are ignoring you or not engaging with you, but that very well may be their strange way. So continue to ask and press about some of those things too.
I also wanted to just add quickly, making sure that the teens in your lives are also aware of these resources is important too, because I don't know how many of you have ever babysat, but I remember babysitting and like parents leaving lists of contact numbers on the fridge. Like, it's not a bad thing to have those resources just listed, because if they're afraid to come to you, they might not be afraid to go to a stranger. So just making sure the teens in your life are aware of those resources is super important too.
Yeah. So some of the questions in the chat, and this I think goes to what Aaliyah was saying, somebody asked about after you've connected somebody with Resolve and you're still worried about the person, you don't hear anything. Is it okay to reach back out? I would say yes. I wouldn't like harass them about it, but sending them a text or an email or however you typically communicate, like, hey, last time I saw you, like, I was a little worried, or, things, after Resolve, I just want to make sure you're okay. Just checking in, just letting you know I'm here and I've been thinking about you. They might not respond to you, and that doesn't necessarily mean anything. But again, just knowing that you were still thinking about them after the fact, that they're not just like a number on your caseload and you're like, well, check that off the list, moving on. Like, they're still in your thoughts, that they are a significant person in your life enough that you want to follow up and you're curious. You don't necessarily need to wait for a response again, and it doesn't mean anything if they do or don't respond. But I would absolutely, I follow up with people all the time. Think about like if somebody dies, like if somebody loses somebody to cancer or to old age or to whatever, like you don't just send your condolences once. I mean, maybe you do, but if it's somebody that's close to you, like, hey, how are you doing? It's been 2 weeks. Like, it's the mourning period is over, like the funeral, all of that has happened. How's it going? You still all right? Right. So still checking in. Aviva, I love what you've said here, because we are talking about teenagers and young people. But the earlier we start these conversations, the sooner we start talking to our kids about their feelings and their emotions and sending the message that this is something we talk about. That's, I don't have research behind me, but that is a protective factor, right? So that when you talk about that with your little kids that are still going to like draw things and want to cut out shapes and scissors. And so now then when they're teenagers, that has stuck with them, right? That's been a common theme in your house. We talk about football in our house and we talk about our feelings, or whatever it is we talk about. Like, that's just a thing that goes on. Oh, your comment is, thank you. Aviva's comment is only visible to panelists, which means none of you saw it. So what Aviva said is she's going to do is a cutout hand at dinner. She has littler kids, younger kids, and putting a person on every finger. Like, who's a person that you have that you can turn to? And maybe for your little kids, like mom and dad are not available. Who else? Is there grandma, grandpa, the next door neighbor? Is there a teacher? Is there a coach? Is there a rabbi? Is there a priest? Who else is in our lives that we can turn to? So talking about these things, pointing those things out as young as possible, those are things that stick with kids. So that's great. Thank you for pointing out that nobody can see that except me.
There's another question in the Q&A box. We just experienced a suicide in our community, and what resources do we recommend for both families, friends, and the community? We have obviously we have UpStreet, which is a part of something that JFCS created to really support and help like ages 12 to 22. But of course, if you're a parent of somebody who's having a hard time, we are available. We have a live chat. Anybody can come on in those hours, that Erin had mentioned earlier. That's 10 to 8 on weekdays and 2 till 10 on weekends. But we're available to, and Erin just put it in the chat. We're available. But yeah, go ahead, Erin, if you wanted to touch on more.
I just shared a blog post. We just wrote a blog post about sort of what to do when dealing with a death by suicide. So it's, it's very on the surface level things to do, but it's a place to start. And it's something I will say we are thinking about. We as JFCS, as an agency, and UpStreet specifically as a teen and young adult mental health program, thinking about developing a community response and collecting these resources together, because they are out there. But we might not all know about them. So stay tuned for more information. I mean, sadly, I don't think this is the end of this conversation. There are other resources out there. Other communities have reached out to us actually that have experience dealing with this, with suicide and multiple losses by suicide in a short amount of time. So it is something we are working on. But any type of mental health treatment, there are support groups that exist. for grief and loss specific to suicide. So those resources are out there. We can send them to you. I know we don't have a PowerPoint, and I think people like to have PowerPoints because it's something to take away. So we can compile a list of resources, suggestions, things, and send it out to everyone after the fact, if that would be helpful. Yes, thank you, Staunton Farms. The American Foundation for Suicide Prevention has support groups for survivors.
Only we can see that, so I'm going to send that in the chat so that everyone else can too.
Yes, and yes, Lorraine, we're recording this, so we will be posting it. It will be all over our social media. It will be on the UpStreet website. Yes, we hear you.
I want to thank our panelists for their information, for their caring, for their compassion. And I think if we all just remember that we are coming from a place of love to the people that we are dealing with and we're coping with. And so go home and text someone that you love them. It matters. And we will be placing all this information in accessible locations. If anybody does want to stay on a little bit longer to chat, feel free. For those of you who have to go, we appreciate your attendance and we look forward to seeing you again.
Thanks, everyone.